Hello, everyone. Good afternoon. I'm Sayuta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans, right from the beginning of civilization. Few of the more common conditions affecting the look and feel of a person is acne, hyper or hyperpigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence. According to recent data, almost 80% of people in the age group of 11 to 30 years have acne outbreak at least once. Although acne most commonly does not have any serious health concern, but is very de-stressing for the sufferer. The faster the issue is diagnosed, more effective will be its treatment. Thus, knowing about acne management from an expert is really essential. For this, today we have with us Dr. Madhuri, a consultant dermatologist from Davangere, live with us to educate us more on acne management. Dr. Madhuri has done her MBBS from Kasturba Medical College and MD Dermatology from Yenapoya Medical College. She is also a member of learned societies like Indian Association of Dermatology, Venereology, and Leprosy, and Association of Cutaneous Surgeons of India. She is very well versed with various dermatosurgery and cosmetology procedures like vitiligo, acne, chemical peels, PRP, laser, and so on. She has practiced in many national and international conferences, and she has participated in many national and international conferences and has various research and publications on her name. It's such a pleasure to have you with us, Dr. Madhuri. A very warm welcome to you.
Thank you. The pleasure is mine.
So, Doctor, today we are going to talk about acne management. And as I have already said, acne is a very common thing. Most of us have gone through it, and it's really de-stressing. So, first of all, we would like to understand, Doctor, what is acne?
So acne is a multifactorial disorder. So you can't really define acne because there are a lot of things that can lead to acne. So like you said, about 80% of adolescent age group experiences this problem. It's a very common problem that we see. So it was supposed to be a disorder of the pilosebaceous unit, though now we have come to realize that there are a lot of factors that actually trigger acne, and it is not due to a single cause.
Right. And many times we see that it's not just the people who are in their teens or, during puberty or adolescence, one experience acne. Many times people who are 25 above experience acne outbreaks, and many times they experience it for the very first time. So how this change of age bracket, doctor?
Okay, so like you said, usually at puberty is the first time where you usually experience acne.
Right.
So adolescents are usually more prone to develop acne. Though when people in the older age group, that is adult onset acne happens, then a visit to the dermatologist becomes mandatory because you have to analyze if anything else other than increased sebum production is causing their acne. So you have to look out for any hormonal issue that is going on with them, probably PCOS or hypothyroidism. So detailed evaluation becomes a must when an older person suffers from acne more than a younger person, because adolescent who is suffering from acne can still have spontaneous resolution. But it is usually more difficult to treat in a patient who is suffering from adult onset acne.
Right. And anyways, as you said, during adolescence, if somebody is experiencing acne breakouts, then it's just, I mean, we all know it's because of the very same reason that, we are having hormonal changes, etc. But when we have acne after 20 or 25, that means there is something, maybe a medical condition, something which is.
Usually, majority of the cases, there could be a medical condition and they have to be evaluated properly.
Yes. Right. Right. And doctor, what are the causes which can lead to acne?
So the causes are again multifactorial. So there can be environmental changes that could be leading to your acne, the temperature, the humidity,
Mhm.
um, the pollution in today's era. So this could be one of the reasons. There could be hormonal variations, like your thyroid is going haywire, or you've started suffering from PCOS. That could be other causes of acne. And something as silly as using dirty linen, dirty mobile phones, and the dirt
Mhm.
which is on the everyday things that we use, which when it comes in contact with your face could lead to acne. So there was
Okay.
this era where we all suffered from acne because of the COVID
Right. True.
season.
Yes.
So
Yes. Yes.
acne could be it's very individually different. So these are usually the causes that could cause, and diet plays a very important role in acne. So if you are someone who is prone to eating more junk food, more of bakery items, things with high glycemic index, you could
Mhm.
be more prone to acne lesions as well. So these are few of the causes that could be triggering your acne. So a
Mhm.
detailed workup is necessary. Yeah.
And Doctor, are there various types of acne? Because sometimes we see very small, whiteheads or blackheads, and sometimes we see like cysts, acne or pimples. So, are there various types of acne?
Yes, acne can be graded into four types actually. So initially, it starts off as a blackhead or a whitehead that we usually, we call
Right.
it a blackhead or a whitehead. It's usually called as comedones in our language.
Mm-hmm.
So grade one of acne will have more of comedones. Grade two will be the tiny red bumps that you see, the pimples that usually people, call it as
Mm.
pimples. So that is grade two acne. Whereas when it becomes more of pustular and bigger nodules, then it becomes grade three
Okay.
acne, where oral treatment becomes mandatory. And then the last type of acne, which is the severe acne, which usually causes scarring if not treated early, that is the nodulocystic acne. So these are usually the four types of acne that are there. And nodulocystic acne will have lots of big cysts and nodules that are, draining, usually filled with pus or draining with pus.
Mhm.
So grading of this acne, the types of acne, is very important for us dermatologists as well to treat them accordingly.
Okay. Many times we see certain patterns, acne in certain patterns. For example, in a butterfly, like, cheeks and neck will have acne, or around the jawline. So, do these, specific patterns, tell us something that the reason could be
Yes, they
similar
do.
for them?
Yes, yes, they do. They do. So usually you get acne on your forehead when you have a lot of forehead bumps, forehead lesions. So either you could be using hair products, something like minoxidil, that itself can, or gels used to style the hair. So
Mhm.
pomade, and so all these, if especially if you're oiling your hair too much, all these could lead to a lot of lesions on your forehead area. And if you're also suffering from dandruff, so it could be a cause of fungal acne, which usually comes on the forehead area. So on the cheeks is usually because of excess sebum production. Also, like I said, the contact of dirty linen or dirty mobile phones on your cheek, that could trigger the acne on your cheek area. The
Oh.
chin, if you have a peeve of pulling out your hair, or constantly rubbing it or constantly holding your hand this way, usually acne tends to concentrate on the chin area. But what we have to be very careful about is the jawline acne, which is usually a sign of underlying hormonal imbalance and is usually seen in the elder people, elder category. Yes.
Okay. And doctor, we have this tradition in our society. In case we have anything associated with our skin, we'll first run inside our kitchen, try some quick fixes, use some home remedies, or else we'll consult a friend and family. Okay, you also had it. What you did? Okay, you did. I'll also do that. Or we will go to some, pharmaceutical shop, get some over-the-counter medication, ask the chemist to help us. It's only when the things get out of control that's when we go and land up in front of a doctor. Now, my question is these home remedies, asking a friend or family, online social media influencers, or these over-the-counter, products, topical creams, etc. What's your stand on all these?
My question is why? We are right here. You just have to come to a dermatologist. So instead of
Right.
using home remedies or going and taking over the counter medications, which usually does more harm than good, the best thing to do is just visit a dermatologist who can guide you as to what can be used, what cannot be used on your face, and help your acne. Because acne, if not treated early, and if you have the severe type, it can lead to a lot of scarring and consequent mental disturbances that occur along with acne. So, home remedies, over the counter creams, or anything of that sort, asking your friend, no. Only ask your friend if the friend is a dermatologist. Yeah.
Or make a
Yeah.
dermatologist your friend. So that will work. But then the thing is that, we have this thing in our mind that natural things are good for our skin. We'll use turmeric, but if somebody tells us that turmeric also have a chemical composition, they'll say that no, 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 it's natural, it's not a chemical. We'll have water. But then if somebody tells us that no, you're having H2O, no, 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 H2 is a chemical. I'm having
That's
plain
true.
water. That's the difference. But so we are ultimately, even with over the counter medication, many times people say, I have, heard people saying that I won't go to the doctor because they'll advise me or they'll prescribe me some steroids. And what they are doing instead, going to the chemist shop, getting a steroid cream which they don't even know about and
Yes.
using it regularly. So, we have all these myths, etc. But the thing is, over the counter medication, we have seen it's really harmful, dangerous for our skin and health. And specifically talking about these combination creams or creams where steroids are there, how harmful they could be for our skin, doctor.
Extremely. Things that are being used on the face, like clobetasol, we don't even give it like for a longer duration on parts of the body. Like, and you're using it on your face for like years together. So the steroid damage that could be done by using such creams are usually, like, I wouldn't say irreversible, but they are extremely hard to treat. So it leads to a lot of skin thinning, and your skin will start bleeding easily with just minimal trauma because of the skin thinning. And there will be a lot of redness and irritation, especially when you're stepping out into the sunlight. And there could be increased growth of hair, which could make you, develop a lot of hair in areas which you shouldn't be having a lot of hair. So these are all the things that steroids could do, and more. And acne might be better only for probably a week, after which it is going to aggravate if you're using steroids, because steroids are not the treatment for acne. So the damage that it does is very mentally, as well as physically damaging to both the dermatologist as well as the patient, because we have to do a
Right.
lot of working on it. Yeah.
And the treatment becomes very lengthy. If
Very
somebody goes
lengthy.
to
Yes.
you at the very first place of spotting an acne or something, then the treatment is much more less
Yeah.
complicated, easy.
Yes. Yes. Yes.
Okay, right. And again, what happens, why we fall, prey to all this, because whenever we apply a cream, which we get over the counter, which have steroids, initially they work as wonder. So we'll say many times, again, people will say that I have got a magic cream. So see, my acnes are disappeared. They have
They
disappeared.
get the glow they want.
Exactly. But then they get addicted to it. And then when they start, they stop using it, of course, the other problem surfaces. So we would also like you to shed some more light about the addiction that we get with that, these kinds of
Yeah.
creams.
Yeah. So the addiction is like how a person would be addicted to alcohol. So it is impossible to, like, for someone who has used a cream for a really long time, it's impossible for me to tell him to stop it on the next day. So there has to be a phase where we taper the steroid from the very potent one to a least potent one. And then we have to manage with other modalities like tacrolimus, etc. So the duration of treatment becomes extremely lengthy, because topical steroid dependent phase is not very easily treatable, and it leads to a lot of acne like lesions, which are not really acne, but an adverse effects of the steroid being used. So there is a lot of difficulty that happens. There is a lot of pigmentation that you wouldn't be having if you hadn't used the cream. So it depends from person to person for the duration of treatment they have used, the steroid that they have used. So all these factors have to be taken into account, and the patient has to be de-addicted from it very, very gently, and with a lot of counseling, because the patient will feel that what you are giving is not doing anything, but the steroid that they used would work magically, at least for a little bit of time. So a lot of hand holding and
Right.
getting the patient through it is very important, more than the treatment per se.
Right. So the bottom line is please don't use over the counter medication, home remedies. Save your energy, your money, your time, and most importantly, your skin, your health. And please go to the right person at the very first spot, which is a qualified dermatologist. Now, doctor, the thing is, when a person comes to you with, these acnes, just by clinical examination, you can tell that, okay, you are, having this, and probably this is the reason why you are having these acnes and what's the grade, etc., or some tests, etc., also done for the diagnosis.
So tests are usually done if hormonal imbalance is suspected. Also, tests are required if we have to initiate any oral treatment. So these two areas are where tests are required. So adult acne is somewhere where we use a lot of tests like thyroid function test. Then we use something called a serum testosterone, or we could use other panels where we can know whether the patient is suffering from polycystic ovarian disease or any of the metabolic syndromes as well. So these are few of the areas where we would do tests, clinical and laboratory tests. But otherwise, in normal pubertal acne, other than to initiate oral medication, I wouldn't do any other tests per se.
Fair enough. And what are the treatment options available, doctor?
So yeah, the treatment is very the easier it is, the simpler it is, the better. So you could usually start with a sunscreen so that you can prevent all the damage that you are getting from the radiation from the sun, as well as use a gentle cleanser if your skin is more of the irritated type. And then you can use topical as well as oral medications based on the grading of acne, like I said. So there are a lot of topical modalities which you would have heard through various Instagram reels, and so there are a lot of things available where people usually use
Mhm.
and then come to us. A lot of creams like clindamycin, antibacterials like ozenoxacin, and then there is benzoyl peroxide. Then there is topical retinoids. So these are all the topical medications that can be used. And oral treatment like isotretinoin is one of the mainstay of treatment of acne. But in this era, there are a lot of there are a lot of procedures being used, like chemical peels, lasers, etc., to get very efficient clearance from acne. So these are all the things that can be considered, and a dermatologist, based on what type of acne you have, they are the ones who can guide you very well as to what treatment is right for you, and not things that you find on Instagram.
Very well said. And as you just mentioned about the procedures, feelings, etc., that's available. The fact is that apart from qualified dermatologists doing these procedures, there are many quacks. There are parlors who who claim that okay, we also do peeling or other things. There are quacks as well, and again, people fall for them. So, what's your advice on that?
Well, there are a lot of steps being taken by IADBL right now to, lessen this burden that we are facing. But I think, see, patients are educated enough to know where to go. So one shouldn't find a simple or a less expensive solution. They are less expensive for a reason, because they are not qualified enough. So, and there are a lot of chemical peels, or a lot of chemicals peels that differs from a dermatologist to a quack to another dermatologist. So one should know who they are going to. They should be certified in what procedures they do. They should have the experience and the learning to do so. Otherwise, the patient is the one who is going to get affected, and they are going to lose hope for no reason, because acne is a treatable condition, but they have gone to the wrong person. That's all. So this is
Right.
what I would say.
Right. So please don't make it over complicated. Just go to the right
Yes.
person at the very first place to go to the qualified dermatologist.
Yes.
And yeah, as we are talking about acne and acne management, and as you also said, that sunscreen plays a very important role. It's important to, cleanse your skin properly. We would like you to tell us, doctor, what's a daily skincare routine, which we can maintain, especially those who have acne prone skin, to prevent acne or to maintain certain level of goodness to
Okay.
us.
Yeah. So, first of all, you have to know what kind of skin you have. Do you have dry skin? Do you have oily skin? Do you have a combination kind of skin? Because then only we can guide you with the products that you have to use. So, once you have
Mhm.
decided that, then you could follow up with a basic sunscreen, which is right for your skin type. Then you could use a gentle cleanser if you have irritated skin, or use something with BHAs like salicylic acid, or foaming cleanser if you have more of oily skin. After which you could have one cream for your acne, for your all your acne, for your breakouts, for your pustules. You could have one or two creams which the dermatologist could suggest you, based on the type of acne you have, and a moisturizer to go with in the end, once you take off your acne anti-acne medication. I think these four things should be well more than enough to tackle your acne, at least initially, without any procedures. So these four things are my go-to when I treat a patient with acne. So a sunscreen, a cleanser, wood
Okay,
cleanser, a moisturizer, and an anti-acne cream or serum based on your type.
prescribed by a dermatologist.
Yeah, yeah, yeah.
Okay. Doctor, as you let's talk about them one by one. Now, with the cleanser part, there are many people, especially who have oily skin. They'll say they'll keep on washing their face every now and then, thinking that if I could stop the oil formation, then that way I could restrict acne formation as well. Is it correct? Can we keep on washing our face every now and then to avoid acne formation?
No, I think more overwashing could also dry out your face and irritate your face, which would make it difficult for your acne creams to work. One, they will irritate your skin, as well as it can lead to increased breakouts. So you have to be very careful about that aspect, because overwashing is not going to magically cure your acne. So you can wash your face twice daily. That should be enough, once when you wake up and once when you come back from outdoors. And yeah, that should be enough to look after your skin. Overwashing is not going to help, and the oil secretion can be reduced with a very low dose ionized isotretinoin that we can use. So you don't have to do that, and that it's going to cause more harm than good.
Right. So two-time face wash is more than
It's more
sufficient.
than enough, maximum three, but not more than that. I wouldn't suggest more than that.
Okay. And again, with moisturizer, same. People with oily skin will say, I already have so much of oil on my face. I mean, why should I apply a moisturizer? And normally they keep on skipping the moisturizer part from their daily skincare routine. What's your take on that?
So, like before, I would agree with it, but right now there are so many formulations that are available, that are made specifically for oily skin, which usually controls the oil production as well. And obviously, it is going to be beneficial for reducing the acne outbreaks that you're having. So, moisturizers will help in that way, as to reduce the outbreaks, as well as calm and irritated skin, and give a good milieu for all the anti-acne creams that you're going to use to work, for them to work. And because it reduces the irritation, the compliance of the patient is more with the anti-acne medication. So
Hmm.
moisturizer has to be incorporated. The right moisturizer has to be incorporated. People with dry skin can use a little heavy, lotion based moisturizer, but those with the oily skin should stick to gel based light moisturizers.
Mhm. And with sunscreen, there are n number of complaints people have. It makes my skin very dull. It makes my skin very patchy. I don't like the white cast or I sweat a lot after applying sunscreen. And with acne prone, people who have acne prone skin, they'll keep on saying that, see, I already have these acne, plus overburdening these acne with sunscreen doesn't seems like a good idea. What would you like to add to it?
So sunscreens do a lot of give a lot of benefits to an acne prone skin. So one is they do not dry out the skin, which will lead to more oil production, and it can cause more acne outbreaks. So sunscreen can help you, have that layer of protection from the UV radiation. And
Right.
it also reduces the free radical damage that your skin, goes through with the constant exposure to the sunlight that you're going to have in your life. So sunscreen should be everybody's first thing to do in the morning after they wash their face. So yeah, sunscreen is something that every acne patient should use to reduce their outbreaks.
So if
And it
you're
can
actually
save
looking
you.
for a magic cream, you should rather go for a sunscreen, right?
Well, everyone should use a sunscreen. Yes.
Okay, and again, because there are so many things, so many sunscreens in the market, and so many information on the box when we go out to get a sunscreen. What are the basics to go for, doctor, especially for those who are prone to acne?
So one, you should look for the formulation that can serve your skin type. Like I said, so someone with oily skin shouldn't go for a lotion based or a cream based sunscreen unless it is non-comedogenic for them. So they should be using something lighter, gel based. Whereas someone with dry, irritated skin can go for something which is more moisturizing, like a lotion. Then there are something called as physical as well as chemical sunscreen. So someone with irritated skin can, usually go for a physical sunscreen because it does not cause as much, irritation as a chemical sunscreen does. Also, the white cast is more commonly seen with physical sunscreen, and it usually doesn't suit Indian complexion. If they're typically on the darker side of the Fitzpatrick scale. So chemical sunscreen would be a better option in those cases. So ideally, it's very individualistic, and you have to have some guidance by a dermatologist to know what treatment would be right for you, what sunscreen would be right for you.
Right. So as you need to use a sunscreen regularly, religiously,
Yes, you have
application,
to.
reapplication is equally
Yes, yes.
important. It's always advisable to go and consult a dermatologist about your sunscreen, your moisturizer,
Yeah,
the
and
basic
the
things
way
as
you
well.
use a sunscreen is also very important. You have to use it the first thing you get up in the morning, because you have to use it irrespective whether you're going out or not. It doesn't depend on it whether you're outdoors or indoors. You have to use it. You have to reapply it every 2 to 3 hours, and especially if you're going out for a swim, etc., you have to use sunscreen which are water resistant, sweat resistant. So these are few things that you have to consider when you're getting a sunscreen, and especially in acne prone skin, they have to be non-comedogenic. So something that is not fragrant free, not fragrant, very fragrant as well, because that can again irritate your acne and lead to increased acne production. Yeah.
Right. I'll also take some of our viewers' questions and then we'll keep continue with our questions. Shania Sen is here. Her question is, can I wear makeup while undergoing acne treatment? And if so, are there any specific products that I should use?
Sorry, I didn't get the question.
Can I apply
Okay.
makeup while undergoing acne treatment? And if so, are there any specific products that I can use? Is what Shania is asking.
Well, there's no right way, I think. You have to try and see whether your makeup is clogging your pores and, they are leading to more acne breakouts. But I usually suggest my patients, acne patients, to not use makeup, because when they have a good, nice sunscreen, they usually do not need another layer of makeup, because that itself will help in, reducing the sweat production, reducing, the oiliness that you get. So a good sunscreen should be enough. But if you do want to wear makeup, then probably a good company, a good company small translucent powder that you get, or one layer of foundation, probably you could do that. But ideally, if you're having acne, the less products you're using, the better it is.
Right. We have one more viewer, Tina Bhargav. Her question is, should I be cautious about sun exposure while managing my acne?
Yes, everyone should be cautious whether you have acne or not, because it can lead to a lot of tanning and aging that no person would like after 10 years, and they would regret not using a sunscreen. So yes, everyone should use a sunscreen.
Okay. A very important question from Faria Beg. Is it safe to pop or squeeze acne lesions at home?
Well, what do you think? No, it isn't.
Right.
You should never do that, because it can lead to a lot of infection that can happen, as well as a lot of pigmentation that might need extra treatment from the dermatologist. Yes.
Right. Many times we see that acne treatment is one thing, and treating acne is comparatively less, painful in terms of complication, etc. But treating acne scars is a big, big thing. So,
Yes.
how to prevent having acne scars, doctor, and in case we have these acne scars or pigmentations, once the acne is settled, what we can do.
So yeah, it is. First thing is, do not pop or squeeze your acne, because that is one of the main causes of acne scarring and acne pigmentation. Secondly, you have to get early diagnosis and initiation of treatment by a dermatologist, because the more inflammatory your acne is, the more of scarring and pigmentation you're going to have. So these are three things that you should be doing as soon as you get acne. um Wait, what was the latter half of your question? The scar management, right?
Please.
Yeah.
Yes.
So the scar, based on what type of scars you have, like there are ice pick scars, there are box scars, there are deep rolling scars. Then there are something called as papilla scars, which are jutting out of the skin. So the treatment depends from each type of scars, and depends from one scar to the other. So there is something called as TCA cross, which is using trichloroacetic acid to close the small needle-like scars that you have on your face. Then there is something called as fractional CO2 laser, which can be used, which are very efficient in clearing scars. There's something called as PRP, platelet-rich plasma therapy, along with microneedling, which gives great improvement in acne scars. And you can go to your nearest provider to know all the different types of procedures that they can do, that dermatologist can do to help your acne scarring.
Right. And again, for these procedures, please go and visit a qualified doctor. Don't fall for quacks or, parlors, etc. Go to the qualified dermatologist and to their clinics and hospitals. We also have Purvi Mehra with us, and her question is, how can I prevent future breakouts and maintain clear skin once my acne is under control?
So yes, the main trick is to not think that you're never going to get acne once you're treated. So there is nothing like acne is under control. Okay, you might not be having lesions at the moment, but you never know if they are going to come back. So you have to maintain a good skincare routine as well as a good diet, so that the same mistakes that you did in your previous outbreak, that doesn't happen again. So maintenance of a good skincare routine for your acne by a dermatologist is very, very essential, because once your skin is clear, that doesn't mean that it is immune to acne, but you should definitely be maintaining it, so that there is no more acne that is coming. One or two during your periods, etc., is normal, and you can have creams at your house, so that you can emergency you can use them and get it treated.
Okay. Now, as we are talking about acne, and we are talking about how many grades of acne or types of acne are there, how to get it diagnosed, how to treat it. Now, the thing is that many a times people wonder, because they are into such professions where they are bound to use makeups. Just now you said that avoid using makeups or use as minimum as possible. There are makeup products with SPF as well available, but many a times for those, especially actors, anchors, etc., where makeup is a necessity, what they can do to not elevate their acne.
So the whole concept of makeup with SPF, I don't believe in. So you use a separate sunscreen along
Mhm.
with your makeup. That is the best thing you can do. Use your products, but use good quality products, something that will not clog your pores, something that's mentioned on the product when you're buying it, that it is non-comedogenic. So products like MAC, L'Oreal, etc., which are of good companies, I think it shouldn't be a problem using it. Use a basic foundation or a powder, whichever that you like, but do not you layer it up with toners, this, that, serum. Don't layer up a lot of products, especially if you have acne. And use a double cleansing method and remove your makeup. More than application, the removal is of prime importance, so that you do not have acne breakouts. So that is one of the things that you have to follow, removing it before going to bed. And use a moisturizer to calm your skin once you're done with the whole removal. So this is how I think, if you have to wear makeup, this is how you can avoid getting acne breakouts by for having a good product base, as well as regular double cleansing and removing the makeup once you're done with it.
Right. So it's equally important to remove the makeup. Doctor, as we were talking about, how important to use sunscreen and it can actually prevent acne as well. But after acne, and especially during the procedures that a person go through, how important it is to incorporate sunscreen post acne as well as the treatment part.
Well, sunscreen has to be used irrespective you're undergoing treatment or not, and it is going to help in a lot of ways other than just protecting your skin from the UV radiation. It reduces the frequency, not frequency, the how much you're aging. It reduces the fine lines and wrinkles on your face. It also leads to decrease in sebum production on your face, and lessens the acne breakouts or the probability of you having acne breakouts in the future. So it has to be one of the things that you maintain even after acne is under control.
Right. Initially, you mentioned how important the diet is, how important role diet plays in acne and acne management. You told us what to avoid. What all can we include, doctor? Hydrating ourselves or drinking plenty of fluids, etc., and green leafy vegetables and salads, etc., fruits. How far they go in maintaining a good skin?
A good diet is of prime importance, especially when you're having acne. So avoiding milk products and dairy products, like curd, etc., and bakery items, junk, basically anything junk that has been fried, that has been in containers stored for a long time. So any of that sort, any of the junk food that you eat is not good for your acne or your skin. So you can incorporate a lot of fruits, a lot of vegetables. Other than the junk aspect of it, something that is, increased in vitamin B12, in all the vitamins, in zinc, etc., that can actually help your acne. So a lot of vegetables, a lot of fruits, a lot of water is going to help a long way in maintaining your acne. So avoidance is the key more than what you have to eat. What you should not eat is of importance in acne, I think.
Right. So eat well, avoid everything that needs to be avoided, lead a healthy lifestyle. That's really important. Keep yourself as stress-free as possible. Now, many times, because you were talking about, what to eat and what not to eat. Many times people say that whatever you are eating, also apply it on your skin. A part of home remedies. Is it good or bad, or could it be harmful for our skin?
It could be harmful to you. So, well, there is no good or bad, because things like lemon, etc., can cause a lot of burns, which might be very difficult to treat later. So I think avoid all kinds of home remedies. There's no good or bad home remedies. Just go to a doctor if you
Yeah,
have.
rather
Yes, eat them.
those
Yes.
food items. And doctor, and doctor, before we sum up, any take-home message for our viewers?
Well, get your acne treated early. Go to a dermatologist and get it treated. Do not shy away from procedures because procedures can help a lot in controlling and preventing your future acne breakouts. And yeah, and you have to maintain a good skincare routine once you're done with acne treatment because it could always come back if you don't, adhere to a proper skincare regimen. So keep it basic, keep it simple because acne is, it's treatable. Do not stress out. Do not be emotionally affected by something as simple as acne. So yeah, I think you should just get your acne treated and then you can go on that way. Yes.
Okay, right, doctor. Thank you so very much, Dr. Madhuri, for your valuable time. It has been a very informative session. Thank you for
Thank you. Pleasure's mine.
participating in this
Yeah.
session. Yeah. And viewers, thank you for your active participation in today's session. And stay with us, keep following us, stay spotless, stay beautiful. Thank you. Have a good day ahead. Goodbye.
You